The impacts have been devastating. Families ripped apart, communities forever altered, loved ones lost too soon. We've been meeting with and listening to Canadians across the country for many months on this, including the recent Big City Mayors Task Force. And we've taken real, concrete action to tackle this issue head-on. A few weeks ago, the Government of Canada announced an additional $65 million over 5 years to help implement the government's opioid action plan. We also announced an additional $10 million in urgent support for response efforts here in British Columbia, where we know that opioid use has skyrocketed. Not only that, we've recently reintroduced harm reduction as a pillar of our comprehensive drug strategy and expanded access to naloxone. In addition, we've adopted Bill C-37 in the House of Commons, which, if passed by the Senate, will streamline how communities apply for safe consumption sites. This is a crisis that seems for most Canadians to be very far away, something that's limited to certain tougher parts of town, to the West Coast, but we are seeing a spread of opioids across the country, and we're seeing it spread far and wide across socioeconomic levels and across communities. I am happy to say that I had a great conversation with Premier Clark about this last night, and we talked about how we're going to be able to work further together on this. I've spoken with a number of big city mayors, including Mayor Robertson here in Vancouver, about how we can do more. And I think it's really important for all Canadians to know that this is something that we cannot continue to ignore. We cannot continue to stigmatize. We need to start addressing this as the real societal health problem, is the real emergency that this actually is as it spreads across our country and our communities.